During the summer, we unfortunately begin to see the number of child drownings rise. Even if a child is saved from drowning, it's important for parents to know that they could still become a victim of what's called secondary drowning, sometimes drowning. And Dr. Leah Douglas from Children's Hospital joins us now to explain this concept. Dr. Douglas, good morning to you. Secondary drowning, what's that?
Good morning. Yes, thank you for having me. So as we approach these fun summer months and plan to get out and be in the pool and at the ocean, I think it's important for parents to review some drowning safety. So, we think of classic drowning as when a child becomes submerged and their lungs become filled with fluid, and they subsequently drown. But we also need to be mindful of a period after a child has had a submersion injury, because dry drowning could occur in which the lungs don't necessarily become plugged with fluid, but the airway, the vocal cords can spasm, causing a low oxygen level and asphyxia.
So what do parents look for? Are there outward signs of this?
Yes, certainly. So you want to keep an eye on your child after any near drowning accident. They would experience some symptoms such as coughing, shortness of breath, wheezing, and then you would probably notice some lethargy, decreased activity level, and fatigue.
So it's something, the important message here is in the unlikely event that someone does experience a near drowning, it can happen. Just keep an eye on your child and be aware that if these symptoms start, as you described, the wheezing and the kind of difficulty, get to a doctor, I assume.
Absolutely, absolutely. If your child starts to develop any respiratory symptoms after a near drowning accident, then I would take them immediately to the nearest ER.
The treatment is what? Just some oxygen, or what do they do for the child?
Yeah, so treatment is generally supplemental. Checking the child's oxygen levels, doing imaging potentially of the lungs to see if there's any retained fluid in there, and then giving them the support they need as their body recovers.
I think in general it's probably a good idea to talk a little, as you mentioned, about pool safety. One fascinating statistic here is that an infant is, particularly susceptible, obviously, but can drown in a very small amount of water.
Absolutely. So I think it's really important, especially for parents of those very young children who will be playing in their little kiddie pools and toddler pools in the backyard, to know that children can drown in just an inch of fluid. So it doesn't take a few feet of water. If a child gets submerged face down, then that's enough to cut off their airway. So then, be mindful of your child, and keep one-on-one supervision at all times, even if it's around a smaller pool or body of water.
Well, that's the thing that can happen, and we've heard tragic stories like that, is a bunch of adults are around and everybody kind of thinks somebody's watching, and there's just that little bit of time where people look away. So it happens so quickly, doesn't it?
It does. It happens very quickly. In 0 to 5-year-olds, we see a pretty high incidence of drowning just from, parents looking away for a few moments, or the child getting into a pool that they weren't supposed to have access to. So making sure that, pool gates are locked, they're surrounded on all 4 sides, and then making sure there is one adult who has one-on-one supervision on one child at all times.
Okay, good advice as we head into the summer months, from Dr. Leah Douglas at Children's Hospital. Dr. Douglas, thank you.
Thank you.